Good morning, everyone, and welcome. I am Estela Mata. I'm one of the co-founders of Looms for Lupus, and I just want to welcome everyone. If you are tuning in on Facebook, on Twitter, and on YouTube, please make sure to comment in the session. During this session, it is going to be a live interaction. So put in your comments and your questions, and we will have a Q&A at the end of the session. We also want to give you a quick disclaimer. Please understand that the opinions shared today are for informational purposes and do not replace any of the medical advice and or opinions of your doctors or healthcare professionals. Our panelists are qualified professionals in their respective fields, and however, they are not liable for their comments since they are not acting as your personal physician and do not know the nuances of your medical history. If you are experiencing any issues with your medical condition, it is important that you follow up with your doctor and seek treatments that are best for you. Thank you again, and we will start off with Liz Helms this morning.
Thank you so much, Estela. It is a pleasure to be here today. I'm Liz Helms, and I'm the president and CEO of the California Chronic Care Coalition. And I'd like to also thank everyone for joining us today to have a conversation on a very important subject. The California Chronic Care Coalition is a patient advocacy organization that was founded in 2006. We have over 30 organizations that represent the different chronic diseases, physician organization, provider organizations, and consumer organizations representing people with chronic conditions. We have been working in the COVID space, especially for people who are compromised since COVID began, and have done extensive work in this. And we believe that access to appropriate care is life-saving and needed. And I think today's discussion that we're going to be having about immunocompromised patients that face higher risks of more serious long-term consequences and how they can access the preventative measures. I mean, now we have preventative measures. Today, we also have an esteemed panel of guests who'll share with us more information about COVID treatment options for high-risk patients and filling the unmet treatment need. And so with that, I will ask for our first speaker, Dr. Jim Seaboldt, to unmute, and it's all yours. Thank you, Dr. Seaboldt.
All right, thank you very much. And just to introduce myself, my name's Dr. Jim Seaboldt, and I'm with AstraZeneca Pharmaceuticals Medical Affairs. And the first thing that I want to do is offer thanks to the California Chronic Care Coalition, as well as Looms for Lupus, for organizing the briefing today. So thank you very much. And for the next few minutes, I'd like to discuss or present a little bit about the landscape of COVID. So if I could have my slides, please. So as I said, we'll talk a little bit about the landscape of COVID. Next slide. And really, when we start looking at the landscape of COVID, I really want to focus down into the immune-compromised individuals. Next slide. So there's roughly 7 million immune-compromised people in the United States, and approximately 2% of those immune-compromised people that are vaccinated in the population, they may not respond because of their immune-compromised conditions. They may not respond adequately or as we would expect them or want them to respond to a vaccine. So people that are vulnerable to that could be people with blood cancers, people that are on active chemotherapy, solid organ transplant people, people on dialysis, certainly people taking immune suppressants, or people that have something called primary immune deficiency, where their immune system just isn't quite up to speed. And there's a great impact to these immune-compromised individuals. If I could have the next slide. So really, before COVID-19 came about, the immune-compromised populations, they still had to take some precautions because they're more susceptible just to other infectious diseases. But then COVID hit, and they had to be very careful because they may not be responding to those vaccines. And then as time went on and more people were vaccinated and we started easing up on some of those pandemic type restrictions, masking and social distancing and so forth, whereas others could sort of ease up on those, the immune compromised patients, they really had to still stick with it because they may not be responding adequately to those vaccines. And so they have a larger burden that they need to bear. And if I could have the next slide. To just offer some proof to that, the CDC published through the MMWR, which is a weekly publication that the CDC puts out, they published a study, and in the study, it was actually looking at immune compromised individuals and their potential to be hospitalized. And they found out that really the burden of the hospitalizations, especially when we got later into the COVID pandemic and up to sort of current time frames, the burden of those hospitalization is really being borne by the immune compromised patients. Now, they're not exclusive, but the bulk majority of hospitalized patients are going to be those immune compromised patients. So if I could have the next slide, please. So I want to talk a little bit, again, about the COVID landscape and about some therapies that we have against COVID. So if I could have the next slide. So really there's a continuum of therapies for COVID, all the way to the left of this slide where we're talking strictly about vaccination. And to be clear, vaccination is still the mainstay prevention for COVID-19. We encourage everybody to get vaccinated, including the immune compromised individuals. Even if we don't expect them to have an adequate response, some response to the vaccine is better than not getting the vaccine. So that first stopping point from the left of this slide is the vaccine. And then as we move to the right, we can see that we can offer pre-exposure prophylaxis. So there's a long-acting antibody that can be used for pre-exposure prophylaxis. And then as we continue to move, we can see post-exposure prophylaxis. And we had several therapies that we could use for that, but because the landscape of COVID is changing very rapidly, some of these have dropped off. So I've put lines through and struck out the names of those medicines that could be used. Similarly, with outpatient treatment, we've lost some therapies there. And then inpatient treatment, we still have some therapies there, however. So we do have some choices, and we do have some preventive medicines that are actually still have a great deal of utility. So let me talk a little bit more about the pre-exposure prophylaxis. I'm not going to focus on vaccines, be it that I've said that vaccines are the most important, but now let's turn to that pre-exposure prophylaxis. So if I could have the next slide, please. So the pre-exposure prophylaxis, there's one antibody that can be used. It's a long-acting antibody. So what's happened is a normal antibody stays in the body for about 15 or 20 days. And this monoclonal antibody, actually it's composed of two monoclonal antibodies, has been engineered to have a longer duration in the body. So it can stay in the body and be dosed about every 6 months, in fact. So much longer than a typical antibody, which makes it very attractive for pre-exposure prophylaxis. So Evusheld was engineered specifically, and it's composed of a cocktail of two monoclonal antibodies, tixagevimab and silgevimab, and they really work in synergy together. So if we were to give either of those antibodies alone, we don't get as good of an effect as when we combine and give both of those antibodies together. And we get a multiplicative, a much better response to that with that antibody. So because of the way that this product was engineered and because of the way that it has coverage, right now the recommendation is for in the immune compromised individuals for a dose every 6 months as needed. All right, so really this product it has been purchased by the federal government, and that in and of itself has interjected a little bit of complexity into the system. If I could have the next slide. So this is just sort of a cartoon that represents that complex system of getting Evusheld from the manufacturer and getting it down to the patient level. So it has to go through the federal government to state territory governments. Then there's a request put into a distributor. The distributor gets the product from the manufacturer. Then it's pushed back out to the state, and finally it gets to the patient. So it can be very complex. And there's a number of hurdles that we have to go through with that. Next slide. So just some of the patient hurdles are in the box on the left-hand screen. And probably the biggest one is that patients may not understand the value that a long-acting antibody for pre-exposure prophylaxis like Evusheld could provide them to help mitigate or prevent COVID-19 disease. And from the healthcare practitioner side of the slide, that's the right-hand side of the slide, there's maybe some confusion. Some practitioners are still using antibody tests, thinking that if somebody has antibodies, then maybe they shouldn't get the long-acting monoclonal prophylactic antibody. That's not the case. There's no recommendation out there for any kind of an antibody test to see if someone is eligible. The eligibility should be as if the patient is not expected to respond to vaccines. Now, these are some of the operational barriers, but I did want to point out that there are some best practices that have really helped out. So in California at Stanford, they've developed a simple one-pager on Evusheld, the long-acting monoclonal antibody, and they list in the Bay Area the locations where immune-compromised patients can get that product. So they've made it a little bit easier for the patients to find out where that product is. And as another example, in Los Angeles County, the county has actually placed a vaccine coordinator who also deals with the long-acting monoclonal antibody. And that coordinator connects physicians' offices to the State Department of Health and sort of streamlines the mechanism where the physicians' offices can receive Evusheld. And they've really streamlined that a great deal for patients. So really, I hope that that's converted a little bit of the landscape for COVID and a little bit of information about pre-exposure prophylaxis. And now I'd like to turn the floor over to Dr. Sanjeet Dadwal, who is going to talk a little bit about his experiences at the City of Hope in treating immune-compromised patients with who have COVID-19. Sanjeet?
Thank you, Dr. Seaboldt, and thank you, organizers, as well as all our patients who are attending this, WebC here. So I thank you, Dr. Seaboldt, about all the slides you presented. I think that's a great sort of segue for the discussion. So for those who may not know, City of Hope is a standalone cancer center. It's a National Cancer Institute designated site in a suburb of Los Angeles, Duarte. And we primarily take care of patients who have cancer, who are undergoing stem cell transplantation. So that's the immunocompromised population we serve here. And at the beginning, back in December, we were able to, end of December, we were able to get access to Evusheld through Los Angeles County Department of Public Health. And we've been fortunate with our leadership support and everyone. And we were able to organize Evusheld clinics for our patients, where we had a day long on Saturday so that patients can come in, get the injection. It is typically required that patients are monitored for 1 hour for any side effects. Fortunately, that has been, not a problem at all, actually. And it was a great, way for us to provide this access to this medication, which we believe is really helpful for our patients who are undergoing active chemotherapy. And because they're getting chemotherapy or they're transplant patients, we know that they do not mount an adequate immune response to the vaccines. And, so far our patients have been, very actively asking for this intervention. They are aware of it. Plus, we also have our own City of Hope website where we encourage our patients on their portal for this treatment. And just as an example, for our transplant patients, we give it to them before they get their transplant so that they're protected at least for 3 to 6 months. And at the end of that 6-month period, if they're still immunocompromised, they're offered another injection and so on. Like Dr. Seaboldt said, those patients who are unlikely to mount an immune response can get this about every 6 months. That's really what I can say. I mean, we've made it very accessible to all of our patients at City of Hope. And I think in the local area, there are major institutions like UCLA Cedars. They have provided access as well. And to Dr. Seaboldt's point, I mean, there are coordinators at the LA County Department of Public Health who can assist in directing patients where they can get it. If there's any other questions, I can take it later. And I'll pass on to Dr. Monica Tang, and she's a professor at UCSF for her comments as far as her experiences with Evusheld.
Thank you. Yeah, my name is Monica Tang. I'm an allergy immunology doctor at UCSF. And so I see patients who have those primary immunodeficiencies that Dr. Seaboldt was describing. So these are patients who have a genetic abnormality that means that they usually are lacking a part of their immune system. So many of the patients I see do not make antibody responses to vaccines, or just in general don't make enough antibodies. So these people are at risk for increased infections, severe infections, and they don't respond to vaccines normally. So they were being very, very careful with COVID. They continue to be very, very careful with COVID. But many of these patients were already receiving treatments of antibodies. So this is historically a way we treat patients who don't make antibodies correctly. So Evusheld was a very natural fit. So the way I explain it to patients often is that vaccines are very helpful. What they do is they stimulate your immune system to make a response to that thing so that if it sees it again, it knows how to respond. But for some people, they won't make antibody responses. So in this case, Evusheld just gives you those antibodies directly, so your body doesn't have to make them themselves. So this, along with vaccines, along with those therapies that Dr. Seaboldt presented, really gave patients with immunodeficiencies or patients who have immunocompromising conditions an added layer of protection so that they have that risk sort of decreased, and they can, some of them have been able to now live their lives a little bit more securely and safely, which I think has been incredibly helpful. At UCSF, we have also made this widely available to all of our patients. Once it became approved, we actually had a large working group of all the doctors that see patients who have immunocompromising conditions. So this was everybody that you can think of: allergy immunology, infectious disease, hematology oncology, nephrology, rheumatology, gastroenterology, cardiology, neurology. Everybody got involved, and we even got in like the infusion center where we created our clinic, the pharmacists that are involved, and also our ethics group as well. And so it was a really big priority for us to make it available to everybody at UCSF and in the Bay Area. And I field questions often from other doctors at UCSF or doctors who refer to us about whether their patients would be eligible, and encourage them if they are eligible to use this therapy appropriately. There are, I think, resources such as this briefing to make people aware, because some doctors don't see immunocompromised patients as often as we do, so aren't as aware of these sorts of therapies. And I also use another resource quite frequently, which is the government actually has created a COVID-19 therapeutics locator that can tell you if there's a hospital nearby or an infusion center nearby that would be able to give, that has stock of Evusheld, which is incredibly helpful for me because UCSF has it, but I see patients in all sort of surrounding areas. And so to increase the access for those patients as well, I find out if there's somewhere locally that they can go to get it too. Yeah, it has been wonderful, and I encourage people to ask questions if they have any about it. I did look this morning, and our clinic has prescribed it to about 78 patients, and at UCSF we've had over 1,400 patients receive Evusheld. So it's being widely used, and we really encourage people to use it if their patients are eligible. I'll now pass this to Estela Mata Carcamo for her comments as well.
Thank you so much. I think all of this information and the briefing that we're having is so needed in the community, because there are facilities like your facilities that have a lot of awareness and assistance for patients, but there are also a lot of patients that don't have that from their providers. So I do thank you and all the panelists for joining and speaking about this important topic. We know that immunocompromised patients do face a higher risk for COVID. And, with today's information, I know that we will be able to share this information and across the board and know that there are more treatment options to protect ourselves. For the immunocompromised community, this has been one of the things that we have been waiting for. And for the next 15 minutes, we're going to open up questions to our viewers. So if you are tuning in, please tune in, let us know where you're tuning in from and type in your questions, and we will start the Q&A now. And before we go to the questions that are posted online, I will go ahead and start with a couple of questions. So the first question is, do providers have all the resources they need to help patient access Evishield? So any one of you can answer that.
So from AstraZeneca, from AstraZeneca, we have a web page, evishield.com, which has a lot of resources on it for the healthcare practitioners that want to or are using Evishield. So everything from brief information sheets, Spanish translations of the FDA fact sheet, which is the labeling, the official labeling in the United States, the fact sheet itself, and then any updates as we've gone through the pandemic with regards to Evishield can be found on evishield.com for providers. So from AstraZeneca's standpoint or part, we do provide that, as well as a medical affairs team that's very happy to engage any practitioner with their questions and respond to those questions.
Perfect. Thank you so much. And what we are going to do is, if Mary can type in that link on the comment section, so all of you that are tuning in can go back and click on the link, and it'll take you straight to the information that Dr. Seaboldt just explained. And I love that you have a one-pager, because a lot of times reading through so many pages can be overwhelming and confusing for the individual. So having one page that gives you all the information in one place is amazing. So thank you. And also another question: how does an immunocompromised patient know where to get Evishield? And I know that we're going to have the link there, but I know that Monica, Dr. Tang, actually mentioned also there are ways that your patients are getting the information. So if you can share how you guys are doing that. And then after you, Dr. Dadwal, I believe also shared how they're communicating with their immunocompromised patients as well.
Yeah, those are great resources. Dr. Seaboldt, I actually give that fact sheet for patients to my patients so that they read about it. And it's actually one of our requirements that patients read about it, know about it, understand what they're getting, so that they understand why and how they're getting this medicine and how it can help them. So that is a wonderful resource that I think is really great. So for patients to access it, it does need to be prescribed by a doctor for you. As well. So I encourage patients to ask their doctor, and if their doctor doesn't know, to reach out to a doctor that might know if they're not completely aware. Like, I can imagine a primary care doctor might need a little help in terms of accessing those sorts of things. But the website that I was talking about earlier specifically discusses places you can go to get it. So at least you know a local infusion center or hospital or site that has the medicine in stock. So if you don't have a doctor, potentially one thing you could do is contact a local site that is giving it, because they'll have doctors that are able to prescribe it, and hopefully get you access that way as well.
Thank you. Thank you for that. Go ahead, Dr. Dadwal.
Yeah, I just have the same comments as Dr. Tang said. Otherwise, it'll be all repetitive from my side. But I think it's important to how should I say, you really need to pitch for yourself, and be proactive, reaching out to your physician. And if they cannot provide, ask where can I go and get it. That is the key part. I mean, that's the most important thing is prevention, and this is a great prevention. But I also think it would be very important to keep on masking. I mean, that's the key part. There's no replacement for masking. That is the best prevention, followed by EV Shield and other things as they come along. So that's what we tell our patients who, again, I'm a physician at a standalone cancer center only, and our biggest comment is please mask, mask, mask. Make sure all your family members are vaccinated, and yourself, have EV Shield. If you don't mount an immune response to the vaccine. And again, Los Angeles County Department of Public Health, at least for LA, or even CDPH, California Department of Public Health. And you just type that word and it'll help you figure out where you can get it.
Yes, self-advocacy, I think, is one of the things that we want to encourage you all patients to do. We are going to be putting all of the links here, the one for the LA County, the one for evushield.com, so you can have the information, because there are some providers that may not be aware, or there's just so many things that they have to be keeping track of. So you as a patient need to take charge of your care and continue to wear your mask, and also print out that one pager, take it to your physician and ask them, is this something that I can get? What do you recommend? Because we know that with immunocompromised patients, it is so important for you to ask also and be part of that care team. And that's really what you can do as an advocate, is to increase more awareness. There are a lot of resources for information for EvuShield and other types of programs that are out there that can help you link to the providers that have the treatment in hand. And I will go ahead and share the link also that Dr. Tang provided us. And let me see if there are any specific questions from the audience. It doesn't look like we have any questions from the audience. So if
I do
there
have a
are,
question.
go ahead.
Okay, so thank you, because I think this is an excellent discussion. We talk to a lot of people that have a fear of getting a vaccine. And so this is such a great alternative to get people, get them some protection that they need. So we as consumers, talking to consumers, want to be able to do a really good job of explaining, in layman's terms, so they understand, how do we remove that fear, and how do we best explain how this works in the body in preventing the COVID, and how it helps to build the antibodies.
Yes. And, that is exactly one of the things that, there's so much fear, there's so much misinformation. So, that is why, again, we wanted to bring this briefing to get you to the right information. I know a lot of people are fearful, but one of the things that I want to encourage you about is, there are resources again, and that's why we are here today. So I do appreciate everyone that came on here to speak about the needs that we have in our community. And thank you to everyone that attended today. If you have questions that you didn't think of asking right now, you can share this amongst your community members, and we will be looking at the questions that you post there, and we will get back to you after the session is live. This concludes today's program. Again, we appreciate you tuning in. We thank all the panelists for taking their time to provide us this amazing information. And on behalf of Looms for Lupus and the California Chronic Care Coalition, we thank you again. And thank you to our speakers for sharing, again, this valuable information with us. So tune in for the rest of the information on the comment section. We will be providing the links. Thank you again, and have a wonderful and safe day.
Thank you.
Thank you.